I'll admit the title of this presentation is a little bit nerdy, but I think if you can look past that, we've got a fascinating exploration of the intersection of Parkinson's disease and psychology, and some tips for living your best life with Parkinson's. In order for us to get to that point, it's helpful to understand some concepts. Specifically, today I want to talk about the placebo effect and dopamine. Let's start off with a brief introduction to the placebo effect. A placebo effect is a beneficial effect that's a result of a drug or treatment that's got no therapeutic value. The beneficial effect is attributed to the patient's belief that the treatment is going to work. Most of the time when we talk about placebo effects, we're talking about it in the context of a research study. So here are our objectives with this presentation. We want to understand what the placebo effect is and why it is significantly more common with studies of Parkinson's disease treatments. We want to understand dopamine's role in Parkinson's treatment. We want to understand dopamine's role in the brain's reward pathway. So that's a role of dopamine outside of what we normally think of it with Parkinson's. And we want to leverage these lessons to hopefully create your own placebos. So let's dive into this in a little bit more detail. What is a placebo? Well, when you have a clinical trial of a new drug or treatment, these trials use a methodology that's known as a double-blind study. And what this means is participants in the study are divided into two groups. One group receives the actual treatment that's being tested. The other group receives a fake treatment, which is called a placebo. The double-blind reference, what that means is the participants in the study don't know whether they're receiving the real treatment or the placebo. The health professionals that are in charge of monitoring, evaluating the participants, they also don't know whether or not which patients are getting the real treatment and which ones are getting the placebo. Typically, only the pharmacist knows, only the one that prepares the drug for treatment. In order for the study to be successful and prove the treatment works, basically they've got to prove that the treatment is better than nothing. And what I mean by that is that the treatment group needs to outperform the placebo group in a way that's statistically significant. So, in other words, the study's got to show that the treatment is better than the placebo, better than nothing. What's interesting is with such a low bar to meet, why do so many Parkinson's disease trials fail or report inconclusive results? There are a few reasons for this. The first one is that Parkinson's disease is not really a disease, it's really a syndrome. What we call Parkinson's disease is actually a collection of symptoms. We don't know the underlying disease pathology. It's very likely that there's a dozen or more diseases or triggers that are causing the body to exhibit Parkinson's symptoms. So with it being different diseases, a treatment that may be perfect for one set of patients may have no effect on other patients. And that's one of the reasons why a lot of research attention is focused on known genetic triggers like LRRK2, where there's more confidence that the patients are experiencing the same disease process. Another reason why we have this issue is because the way that Parkinson's disease severity progression is measured, it's based on symptoms, not an underlying disease. The clinical assessment of Parkinson's disease severity, it's an observational. Clinicians rate the severity of Parkinson's symptoms to give an overall score that rates the severity. You're typically dealing with two different scales here, the Hoehn-Yahr, which has the 5 stages of Parkinson's, and more commonly used in the clinical trials is the UPDRS, the Unified Parkinson's Disease Rating Scale. And that's where the clinicians observe different symptoms of the patients, and they assess each of these symptoms separately, and then they add the results together for an overall score. When you're in the neurologist's office, you're probably familiar with part 3 of this test, which is the motor examination. And you just know that your scores can vary widely from day to day or even the time of day. So That's one of the reasons that results can be so inconclusive with these studies. Research does continue to search for biomarkers, a scientifically measurable indicator of the disease. But right now, we're based on these observational clinical assessments. The third reason that many of these studies don't succeed is that in clinical trials related to Parkinson's disease, there are consistently a significant number of individuals that see improvement during the study as part of the placebo group. So we're talking about people that receive a fake treatment seeing improvements during the course of the trial. So what are the likely causes of this placebo effect? Well, the one cause is that there's this anticipation, excitement about a possible cure. You're in the clinical trial, you get a possible cure, and that causes enhanced dopamine production. That effect can be enhanced by genetic factors in some individuals. Specifically, there's about 25% of people who genetically produce a COMT enzyme that's less effective at breaking down dopamine. So for these people, when dopamine is produced, it lasts in their system longer. Another cause, the design of a double-blind study follows a formula that has been shown to maximize the dopamine response in participants. And we're going to talk about that a little bit later in this presentation. So there's a lot of things we don't know about Parkinson's disease. We don't know what causes it. We don't know how to stop the progression. We don't know how to stop it getting worse. But there are some things that we do know. And that is that the motor effects of Parkinson's are caused by a lack of the neurotransmitter dopamine in a particular area of the brain. Prevailing wisdom, this is not something that's been proven, but prevailing wisdom is that by the time Parkinson's is diagnosed, more than half of the dopamine neurons in this particular area of the brain, the substantia nigra, are no longer functioning. Dopamine is a neurotransmitter that's used to relay messages to initiate and control movement. So this dopamine deficiency causes the motion disorders that are characteristic of Parkinson's, including tremors and difficulty in initiating movement. So Parkinson's is typically treated with drugs that focus on enhancing dopamine. Carbidopa-levodopa is the most commonly used medication, also known as by the brand name Sinemet. It's a combination of carbidopa and levodopa. Levodopa is a precursor that the brain can easily convert into dopamine. Carbidopa gets combined with the levodopa to help the levodopa cross the blood-brain barrier so that it can reach the brain. Remember, you're taking this as an oral pill. In order for it to get to your brain, the carbidopa helps it get through the blood-brain barrier so that the levodopa can reach your brain and the brain can convert it into dopamine. Other treatments that are commonly also used, dopamine agonists, things like pramipexole and ropinirole. These are chemical compounds that bind to receptors in the brain and act like dopamine, but they're not really dopamine, but they can provide some of the functionality of it. There are also two enzymes, MAO and COMT, that break down recycled dopamine after it's been used. So you have drugs that are MAO inhibitors like Azilect, Selegiline, and you have COMT inhibitors such as entacapone that inhibit these enzymes to help dopamine that has already been produced to last a little bit longer. So all of these common drug treatments for Parkinson's are focused on enhancing dopamine. They provide symptomatic treatment only. They don't stop or delay the progression of Parkinson's disease, but they affect the symptoms by introducing more dopamine, higher dopamine levels into your system so that you can move better. And I like to think about dopamine outside of the Parkinson's disease context. Dopamine has quite a reputation in popular psychology. A lot of people think of dopamine as the pleasure chemical. This is what your brain releases when it's experiencing pleasure. It's the feel-good neurotransmitter. But the reality is actually a little bit different from these popular beliefs. A lot of my thoughts and opinions about dopamine from the psychological perspective have been inspired by Dr. Robert Sapolsky, who is a professor of biology and neurology and neurological sciences at Stanford. He's the author of a wonderful book, Behave, The Biology of Humans at Our Best and Worst. And one of the key things that he talks about in his book is how it's the anticipation of a pleasurable reward that causes dopamine to produce, not the receiving of the reward itself. And he references a primate study, a study with monkeys. And these monkeys are trained that when a light goes on, they can press a lever and receive a reward. So some basic conditioning training. What they found is that once the primate began to associate the light with the reward, the researchers could measure that more dopamine was produced when the light turns on than by the reward. So in other words, once that light goes on, the monkey's like, oh yeah, I know what to do, man. I know what to do. I just press the lever. I'm going to get my reward. So it's at that early point before the reward that dopamine is actually being produced. The next 3 slides contain charts taken directly from Dr. Sapolsky's TED Talk, The Uniqueness of Humans. This first chart shows the popular perception of dopamine. You've got a signal that there's an opportunity for a reward. You've got the work that goes into getting the reward, and then you've got the reward itself. Popular perception is that dopamine is produced when the reward is received. But that's not the way that it actually works. Dopamine starts being released when there's a signal that there's an opportunity for a reward, and it continues to be produced through the period of work effort that's required to earn the reward. And then it stops being produced when the reward is actually received. So in the case of the monkeys, the signal was a light turning on, the work effort was just pressing the lever. But you can see how this applies more generally to goal-directed behavior. In this study, they also looked at what happens if the reward is not given every time. What if the reward is only given on average 50% of the time? Well, it turns out the amount of dopamine that's produced skyrockets. That the uncertainty in introducing this maybe factor causes even more dopamine to be produced. The primate is even more motivated to achieve the task because maybe if they try harder, they stand a better chance of getting the reward. This is a psychological concept known as intermittent reinforcement. So just to recap here, if the reward is only given randomly, averaging 50% of the time, far more dopamine is produced every time, even without the reward. Because remember, the dopamine is produced during that anticipation stage of the signaling and through the motivation stage of the work effort that's required to earn the reward. And this maybe factor creates more anticipation, more excitement, and more motivation. So do you see any parallels between that and a typical clinical trial? In a clinical trial, you've got patients that are full of anticipation that this is the clinical trial that cures their disease. They're so lucky they got selected for the clinical trial. This is it. They just know this is going to be the one. And then you've got 50% of the participants receiving the real treatment and 50% of placebo. So you got the maybe factor optimized for maximum dopamine release. So what's not to say that some of this excess dopamine finds its way to other parts of the brain, and voila, we see an improvement in Parkinson's symptoms, similar to that of taking the drug levodopa. So scientists know that dopamine drives goal-directed behavior. Dopamine is not the reward, it's what drives you to get the reward. So it's the belief that you will receive a reward that produces dopamine, and the work and effort in pursuit of a reward also produces dopamine. The reward, it's just a reward. So another concept that Sapolsky likes to talk about is delayed gratification. If you recall, the study we were just talking about was based on primates, monkeys. Humans have a much higher tolerance than animals to wait for a reward, although my dog sure seems to have a high tolerance waiting for a reward. She'll sit there and stare at that cookie jar forever. But anyway, talking about delayed gratification. As an example, we're willing to work hard to get into a good school so we can get a good job, buy a nice house, earn enough money to afford to send our kids to a good school. The old circle of life. So we have this, instead of the pursuit of happiness, it's more like we're producing dopamine through the happiness of our pursuit, our goal-directed behavior to do these things, to better our lives, to better the lives of our kids. We see that we see that as a reward, a delayed gratification reward, and we produce dopamine through this process. It can even be argued that in some religious concepts, the idea of making sacrifices today in anticipation of the promise of a heavenly afterlife, that's a delayed gratification type of scenario, and it is something where you can produce dopamine. Dopamine is also involved in the learning process. There was a fascinating study out of the University of Michigan a few years ago about dopamine signaling the value of work. Now, normally when we think about dopamine, we think about it as being positive reinforcement, dopamine being something that leads us to a reward. But in this study, they concluded that dopamine can also signal errors in reward prediction and provide a learning or a teaching signal. Kind of like a coach telling his player that he did a good job or a bad job in order to mold behavior toward earning a future reward. The study also got even more complex than that, and basically they believed that dopamine could convey a constantly changing decision variable that estimates the value of the reward versus the amount of effort work that's going to be required to obtain the reward, and to provide a level of motivation appropriate to that value equation. So I want to connect these two sides of dopamine, the Parkinson side and the psychological side. And I think the way that it seems to be most clear on that is that one of the most common side effects of Parkinson's medications is addictive behavior, gambling, hypersexuality, obsessive involvement with new hobbies. These side effects are mostly common with dopamine agonists, which act like dopamine, but they're kind of fooling the brain's reward anticipation circuitry because it's not real dopamine. That leads to unusual addictive behavior. So we see that by messing with dopamine for Parkinson's, we're also affecting the psychological side of dopamine. So how do we leverage or use this information to do something useful? Well, my idea is to create your own placebo effect. And what I mean by that is the idea is not to create the placebo. The placebo really isn't that important. The idea is to create an effect that's similar to the placebo effect. So what I'm talking about there, when you create a manufactured placebo effect, we're really talking about something that increases your dopamine production. It might include a placebo therapy. It might include goal-directed activity. And you don't have to limit yourself to just one placebo effect. I believe that you can get more benefit from having multiple placebo effects in your life. So how do we increase dopamine? Well, we know that dopamine is essential to the motivation and learning processes. So your neurologists are always telling you that you should engage in activities that you enjoy. And that's kind of a simplistic look at dopamine. It's better that you engage in activities that you enjoy that also give you motivation. So activities that require some work, effort on your part in order to produce enjoyment. If you think about that chart earlier on about dopamine being produced when there's signal that there's an opportunity for a reward, and it's produced all through that process of work and effort to earn the reward. So you want to maximize that. You want to engage in activities that you enjoy, but you'll get better results if they are activities that require work and effort in order to produce that enjoyment. I also think it's a good idea to engage in constant learning. Try to learn something new every day. Try to apply that learning to something as well. We also talked about dopamine's role in goal-directed behavior. So recognize opportunities for goal-directed behavior. Find activities and causes that you believe in and work to support them. Set goals, work hard to achieve your goals, support the activities and causes that you believe in. Number one, I think attitude is important. behavior and attitude can have an impact on our dopamine production, both positively and negatively. If Parkinson's makes you feel sorry for yourself and you see nothing but struggle in your future, nothing to look forward to, then you've got no anticipation in your life. And there's no reason for your brain to produce dopamine. By contrast, if you've got a positive attitude where you can celebrate the smallest of victories, this is something that can trigger dopamine production. If you're looking forward to seeing your children and grandchildren grow and succeed in life, looking forward to getting together with friends, planning trips, making time to engage in activities that you enjoy, these are activities that give your brain reason to release dopamine. I think this placebo effect also applies to alternative treatments. There are many alternative treatments that are uncertain and unproven. You go into them, maybe the treatment's going to work, maybe it's not. You got that maybe factor, but maybe even if the treatment doesn't work, maybe you'll receive a placebo effect. So I personally think it's a good idea to try alternative treatments within reason. But you need to be careful. You don't want to jeopardize your health. You need to really evaluate, is it safe? That's something it's worth discussing the alternative treatments with your doctor. From a safety perspective, the doctor's going to say that it's an unproven treatment. There's no proven benefits, but just ask, is it safe if you're considering it? That's the medical opinion that you need. And you also don't want to get ripped off. I mean, is it expensive? Is it something that, is it something that you can afford spending your money on a treatment that may be a complete sham? I also like to say that there's an interesting argument for how just the action of volunteering and fundraising for Parkinson's research not only helps enable research that will benefit Parkinson's patients in the future, but they can also improve your Parkinson's symptoms today. I call this the unexpected placebo effect of volunteerism, or put it a lot more simply, feeling good by doing good, or giving his own reward. If you're raising funds and trying to reach a fundraising goal, this creates anticipation, motivation, and satisfaction. There's also a sense of delayed gratification knowing that you are helping an organization like Michael J. Fox Foundation, the Parkinson's Foundation, Cure Parkinson's Trust, or many others that are funding and promoting research that may ultimately find a cure for PD. So that's the delayed gratification factor. All of this, whether we're talking about anticipation and motivation of trying to reach your goals today, or the delayed gratification about the future, these are things that can only help to boost your dopamine production. You can also apply this to exercise. Find exercise activities that you enjoy taking part in, that you look forward to, things that are pleasurable so that you're creating that dopamine from that anticipation. Set exercise goals, celebrate small achievements, try to improve in your exercise activity, try to leverage motivation. And also, on the delayed gratification side, stay positive. Remind yourself that you're doing this for yourself and for your family to hopefully delay the progression of Parkinson's disease. Socialize, plan get-togethers with friends, plan trips. You really want to leverage the power of anticipation. You want to take part in activities that you enjoy, and that's how you create your own placebo effect. So I hope you see through this discussion that the placebo effect is more than just an arcane term used in research studies. I do believe that it is something that you can find a way to leverage to help improve your own Parkinson's journey.